Good morning. It's time to get in touch. Brought to you by Geisinger, Muncie, and Jersey Shore. State-of-the-art healthcare close to home. Every week, this public affairs show shines a spotlight on people and programs in our communities that improve the quality of life in Lycoming County and beyond. I'm Freddi Hammer, host of In Touch and news director at Backyard Broadcasting. On In Touch today, we're shining a light on an important health topic, stroke awareness. May with Stroke Awareness Month continues to be a time dedicated to educating and empowering communities with life-saving knowledge. And to help us navigate this critical discussion, we're joined with Star Bixby. She's an RN, a dedicated trauma nurse who does a lot of community outreach. She's here to share insights on recognizing the warning signs, reducing risk factors, understanding latest advancements in stroke treatment. Good morning, Nurse Bixby. How are you today?
I'm good. How are you?
Good, thank you. Why is Stroke Awareness Month important? What are the goals as you go through May and try to make sure people are aware of what's going on?
I think stroke awareness matters because it can cause such long-term serious disabilities for a lot of people.
Okay.
Because every 40 seconds, someone in the United States has a stroke.
Wow.
And, if we can recognize that quickly, we can provide interventions and treatments that can help minimize the damage caused by a stroke and even save lives. So this month is very important to all of us who work in pre-hospital emergency departments to really go out and teach the public how to recognize these symptoms so that maybe they can save a loved one, a friend, or somebody they don't even know. It's a pretty important initiative for all of us.
As a trauma nurse, do you see a lot of stroke coming in through the ER, or is that something you work with the most?
We do. So my role here at Geisinger Muncie is I do part of the stroke program, and then I also do the trauma program.
Okay.
So I have two roles that I play here. So I get to see a lot of both. I say it's probably about a 50-50 census for us here with both of those patient populations. So we do see a lot of stroke patients here, and the thing that we're seeing in this area between myself and my coordinator up at Geisinger, Jersey Shore, is the patients are getting younger and younger. We've had a couple instances this year where we had patients in their 30s and 40s having strokes. So it's not just, people think, it's because it affects the elderly patients. It's being shown that it's affecting patients younger and younger.
Are you noticing that that's a lifestyle issue, or is it a medical issue that they're facing?
I think, honestly, it's a combination of both.
Okay.
I think as we look around us, we see that definitely there could be some lifestyle modifications. We have a lot of people who smoke or vape. We're not in the best shape of our lives like we used to be. Mm-hmm. We're not really watching what we aren't modifying our choices in life that make things better, like diabetes and things like that. So I think we've really gotten away from self-care, because those are all things that lead to having symptoms of a stroke, like high blood pressure, things like that. For a lot of people, not all people, some people can just have symptoms of a stroke that come out of nowhere. I myself am a stroke survivor.
Okay.
So this really hits home with me. Had no risk factors for a stroke, never had really any medical problems. And about 5 years ago, I had an occipital stroke. So it can happen to people who are fairly healthy, and, we just need to be more cognizant of listening to our bodies and listening to changes within our bodies and just doing that a little bit of 5 minutes of self-care every day. Even just 5 minutes is all it takes, is to kind of take inventory of yourself and say, okay, what's going on today? And how am I feeling? Do I need to step back, slow down? Do I need to eat a healthy lunch? It's just things like that we get away from because we're all just so busy and on the go all day long.
Mindfulness is a big word right now. That's definitely what we need to put forth for ourselves, mindfulness about our health.
Absolutely.
When you say it was an occipital stroke that you suffered, is that just the part of the brain, the occipital lobe? And can a stroke happen anywhere in the brain?
Absolutely. A stroke can happen anywhere in your brain, and it can happen in multiple areas of your brain at the same time.
Okay.
What I had in mine affects mostly my balance. I have a little bit of right-sided weakness. It affected my swallowing. It's affected my vision, and I have permanent tinnitus now.
Oh.
So for me, when I'm having an off day or I'm stressed or I'm tired, you'll notice because I have an ataxic gait, which means I kind of lean to my right side and I don't walk like I normally would. So that's how my coworkers or my friends or my husband know that I have something going on. that I'm not recognizing is because my gait gets off.
Okay.
So it's just little warning signs that I notice with myself as well, that I'm like, I have to remind myself to pick up my right foot sometimes.
So there's the two types of strokes, one caused by a blood clot and one caused by bleeding in the brain. What kind of stroke did you suffer, and how can we address the two main types?
So mine was an ischemic stroke, which
Okay.
just means I had a lack of blood supply to that part of my brain, and they determined that mine was due to a hypertensive crisis, which means my blood pressure was well over the normal limit, which I had never had any issues with blood pressure before. So for me, it was quite a shock, when I ended up having an ischemic stroke. I'm like, this does not make sense. I've never been a known hypertensive. So I think those are the type of strokes, that people can try to keep an eye on things, because some people know from a young age that they have these risk factors, right? We know we have high blood pressure. We watch it. We watch our cholesterol. We watch things that are going to cause those types of blockages. That's why the doctor puts us on cholesterol medicines or tells us to stay away from the fried fatty foods, things like that. In my case, I didn't really have any of those risk factors. So for some people, you don't always have to have those horrible risk factors. For whatever reason, you're that person that day out of that population that's going to have a stroke. The hemorrhagic strokes, those ones are pretty severe for most people. And I think those are the ones that you see that require more of the post-treatment care. The blood clots that you get that cause those hemorrhagic strokes, they can be pretty extensive, and a lot of those need to have an invasive procedure done to relieve that clot or get rid of that clot. We do have medications that we can give, but when you have a hemorrhagic stroke, which means you're bleeding, you don't want to give those types of medications because it'll cause increased bleeding, which you don't want when you already have a bleeding problem. But we've come so far in the interventions and the treatments that our neurology teams can do. It's quite amazing what we've developed over time to help save people, because it's just like your heart. Brain is time and matters, and all of it plays a part in how well you do in the end.
If you're quickly recognizing a stroke, that time matters. Is that because the pathways aren't blocked so quickly, and then you can sort of keep working with those pathways in the brain? Is that that's how I understand it, but correct me if I'm wrong.
Yeah, the sooner we can get involved with the patient, we can open up that blockage or get rid of that clot that's formed in there. That's getting oxygen and nutrients back to the brain that they need to prevent further damage. So for us, it's just a big deal to get that brain everything it needs so that it's, doing the best that it can. When you lose oxygen to your brain, some of that damage can be permanent, and you can't get that back.
Explain to us the acronym FAST, FAST, so that we can sort of think about the symptoms that we're seeing in a loved one if they're having a stroke.
Perfect. So actually, the American Heart Association has actually added another piece to the front of that acronym, so it's called BFAST now, because they've seen so many patients with posterior strokes or strokes that occur in the back of the brain. So now the B stands for balance. So like myself, mine was definitely a balance issue. And the E is eyes. A lot of people will have issues where they see double vision, or they lose a sense of vision out of one side of their visual field compared to the other. And then the FAST is face. So you'll see a lot of people, you'll notice they have a facial droop, or they start drooling out of the side of their mouth. So that's the F. A is arms. Ask them, you'll notice they can't use an arm, or if they do use the arm, it's a lot weaker than the other. That's a key sign that you're having an issue with your brain. So looking to see, can they move their arms and legs normally? The big one is speech. A lot of times you'll see people, they'll have blurred speech, or they'll have words that you can't really understand well, or they'll be searching for a word. I know I struggle with word finding. Know what word I want to say, but for the life of me, I can't find that word to pull it out of the back of my brain. And you'll see a lot of patients get that. Some people have expressive aphasia, where they think they're saying what they want to say, but they just can't seem to get it. And that's very frustrating for a lot of people. You'll see some people have what we call word salad. That is where they're just talking and they don't even have any idea that what they're saying makes no sense, because in their mind, what they're saying is a normal conversation like what you and I are having right now.
Uh-huh.
But to the rest of us, we're looking at them like, what is going on and what are they doing? There's great examples out there of people who are actually interviewing other people, or people who work in the news industry that are live on the air, and they have word salad and don't even realize it.
I've seen clips of that.
Yeah. And then the T is just for time. And the thing we tell people, don't mess around. Just call 911. Don't worry about putting them in your car. None of those things. Just call 911 and get the help that they need right away. No waiting around.
Can they advise over the phone what steps to take and then wait for the paramedics to get there? Is that what would be recommended?
Absolutely. And our EMS teams around here, they are very well educated and trained in stroke recognition, stroke treatment, and they're a key part of getting initial care for these patients. They make a huge difference in the lives and outcomes. Like, they'll let us know ahead of time. When they call us, they can say, okay, we are out maybe 10 minutes from your facility. We have a patient who has a stroke. Their symptoms started at such and such a time, and this is what we have now, and we will see you in 10 minutes. So what that does for us and our emergency department physician is it gives us that added benefit of time.
Okay.
So we can get our CAT scan table cleared for an immediate CAT scan of the brain. We can have our teams around. We can notify the pharmacy, because we'll do a stroke alert. We'll get all of our key players in that room. So when that patient comes in the door, we're literally waiting on them.
When they get there, what is the next step? You have a table prepared for them. You're taking the measurements. What then do they go through in that next few hours?
The initial thing we'll do is the ER physician will evaluate the patient. They'll do a stroke assessment on that patient as soon as they come in the door. And if they feel that this is definitely, something that they feel is stroke or stroke related, they will take them directly to CAT scan. We don't even take them into a room. We'll go directly to CAT scan, get them on the table, and get an image of that brain, because we want to know, is there a problem in that brain? If they notice that there's something wrong, we can give the clot-busting medicine that we call tenecteplase. We can give that so it can go in there and break up that clot. But in order to give that medicine, you have to make sure the patient meets all the right qualifications, because, again, this medicine has great effects, but it can also cause bleeding. So you want to make sure the patient's the perfect candidate for that type of treatment. So we'll make sure that they get all their labs drawn. They'll have IVs in place, oxygen if necessary. They all get an electrocardiogram. They have frequent vital signs and neuro assessments done. For us, it's every 15 minutes for the first hour, and then hourly after that if they're stable. So they get a lot of hands-on. I'm sure they get tired of the nursing staff being just right there all the time, but it's honestly done for a reason, because we want to pick up on any changes, good or bad. And then our goal is to have the patient out of our facility in less than 180 minutes to get definitive care if that's what's needed.
Do you find that family members have misconceptions about what's going on? Is there anything you need to remind people about so that if they do have a patient or a family member, a loved one that needs to come in for stroke care, what things should they keep in mind?
I think the biggest thing we see is just don't hesitate. You dial 911, you get the help you need. If you're even just a little bit worried, or if you get that little bit of sense deep down in your belly that, hey, something's not quite right with mom or dad or one of your loved ones, pick up the phone, call. I'd rather you come in and have us say, nope, they're great, we're going to send them home, rather than have them come in 2 or 3 or 4 hours later and have permanent damage because they had a stroke several hours before, the day before, and they didn't get timely treatment.
So what are our steps to take to avoid any stroke-like symptoms? We need to make sure that we're checking our numbers, I guess, with the doctors that we have.
Yep, you just want to make sure you're doing all the right things, like it's beautiful weather out now. Get out, walk a little bit every day. Watch your intake of fatty foods. Summer's a great time to have those nice, healthy salads, is what we tell people. Stay away from the fried, fatty foods. Not saying you can't have any. You can always treat yourself. You can have a little bit of something here, but do it in moderation. And the big thing is, if you have diabetes, stay on it. Keep track of your blood sugars and your medications and follow up with your primary care doctor to make sure that those numbers are where they need to be. And like we said, the biggest risk factor that we're seeing with ischemic and hemorrhagic stroke is blood pressure control. We definitely need to make sure that our blood pressures are under control. And like I said, a lot of times people don't realize they're having a problem or they have an ongoing problem because that's what they're used to. So that's one of the biggest things that a takeaway point is I can tell people is just make sure you're listening to your body and what it's telling you. Because blood pressure is very much a modifiable thing, and you can prevent a lot of permanent damage just by controlling your blood pressure.
A friend of mine had an issue. She lives in the Philadelphia area and had an onyx polymer injected into her brain after an incident.
That's something I'm not real familiar with. That'll be something I have to look up, quite honestly. Our interventional radiologists in Danville, they're really good about going into the smallest little vessels and getting clots and retrieving them.
Amazing.
But there's just so many things out there anymore that you can do. Every day it seems like there's something more, and we're advancing healthcare a step further, no matter what area of healthcare you're in. It's just amazing to see the progression.
Well, thank you, RN Star Bixby, the clinical team coordinator at Geisinger Medical Center in Muncie, trauma nurse. You do so much for us, and I'm so glad that you could help us know more about strokes, and May being Stroke Awareness Month. Thank you for being on In Touch today.
Oh, well, thank you for having me. I appreciate it.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us for questions, comments, or topic ideas, call weekdays 570-323-8200 or email me at fhammer@backyardbroadcasting.com. For archived files of our In Touch shows, find our Backyard Podcasting link on any Backyard Broadcasting website or subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch. Brought to you by Geisinger, Muncie, and Jersey Shore. State-of-the-art healthcare close to home.